Legal practitioner Chloe Brandt alluded during an interview that if one cannot acknowledge the right to health, it becomes difficult for one to know other human rights to housing, life, and dignity.
The Constitution of the Republic of Namibia makes no explicit provision for the right to health or healthcare, but this is underpinned by many other rights, such as the right to life, the right to dignity, the right to housing. And without the right to health, or without realizing the right to health, we cannot sort of realize all the other rights. So while it's not expressly or explicitly made provision for, it is underpinned by the other rights in the Constitution.
Senior legal advisor in the Office for the Attorney General, Sarah Nishidimbwa, says there ought to be a distinction between domestic laws and policies on access to health.
We are distinguishing between the right to health, in other words, the accessibility of healthcare. We need to make that distinction. And where someone presents themselves at a health facility and that the services they've received there is unreasonable.
Right.
The National Health Policy Framework will empower all Namibians to actively participate in activities which promote good health and prevent ill health at individual, family, and community levels. The public system will provide an enabling environment for this to happen through supporting community health. The Patient Charter promotes respect and integrity of patients and speaks to all people having access to health care. Infrastructure and human resources are some of the issues that needs to be addressed to speak to the population within a given geographical area.
We have various guidelines. In recent times, the Ministry of Health adopted STI guidelines. This again speaks to the provision and access to healthcare. So we have various policies in place, and again we are guided, the Ministry of Health is guided by its strategic framework, you know, in the delivery and provision of this healthcare.
Yoleni Shiapela, NBC News, Windhoek.